Maybe I should drive.
No, I'm fine. I've got my mind occupied.
Susan, we've got to tell Georgia.
No, not yet.
She's your sister. She needs to know.
She's still too fragile. What was that?
What?
It looked like a baby in a buggy on its own.
So, still on for tonight then?
Definitely.
And you remember the tickets?
Tickets? Oh, that's tonight.
If you'd have brought the tickets, then you would have remembered it was tonight. What's going on, Chao?
All right, up to you on one of those, you know. Riding through the Italian Riviera, wind in your hair, living the Vida Loca.
Dolce Vita, Jeffrey.
All right, French Riviera then. Who's that?
Carol.
Oh, what, the prison officer bird? Mm-hmm. All right, you taking her out then?
Dunno, let's see how today goes, eh?
Oh, come on, mate, I'll iron you a shirt. There you go. Yes.
You can't park there.
It's a bike, it's not in anybody's way.
There's a public car park around the corner. Just follow the signs.
You're awfully well-dressed for parking attendant.
Fine. It will be towed. So long as you know.
I don't think so.
Ah, Mac, there's a scooter just outside. It needs to be removed.
Right you are.
You'll need bolt cutters.
I think we've got a set for emergency amputations.
Good morning. And what can I do to you? I mean, for you?
I'm Dr. Lily Chao. I have an appointment with Dr. Hannah.
Yes, of course. We've been expecting you. One of our new F2s. I'm Noel Garcia, head of reception.
Dr. Hannah?
Wait here.
Elliot?
Stop it, please! Please leave him alone!
Kiss your man!
No, please leave him alone!
Get down! Get out! Come on! Get his pockets!
All right.
Stay still! Nigga, where's the money? Back, come on, let's go! No, 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 no! He needs hospital!
Looks pretty nasty, but I'm sure with big muscles like this, it'll heal in no time.
Interesting.
New junior doctor. A bit fierce, but I think I can take it.
Neil, which way?
It's, Noel, and it's, Zoe. New F2, Dr. Lily.
Lily Chao. Pleased to meet you, Dr. Hannah.
Hello, Lily. This is Dr. Ashford. He's one of our consultants.
We met earlier.
Yes, we did.
Susan!
Elliot!
Susan!
Oh!
All right. You okay? All right, I've got you. Okay. All right. You okay?
So, just a bit battered. Are you okay?
Yeah, I'm fine. Don't worry about me. Look, can you walk?
No, I'm not well. Yeah. Listen, Elliot, you need to go and get help. call in and go home. No one needs to know we were together.
No, I can't do that. That's ridiculous.
We have to do it this way for Georgia. If the ambulance finds you here, she'll know. You really need to look after her. The ambulance can take care of me. Please, Elliot, go. Go.
So, you come to us after a 6-month rotation in gerontology?
Correct.
How was it?
Old people are either very sweet or very rude.
How is it medically?
By the time they get to that age, you are not really curing them as much as maintaining them.
I trust you wouldn't say that to an elderly patient.
No, I'll be stuck talking to them for hours if I did.
Is this your first ED placement?
Yes,
What are you expecting?
all of human life.
You think you can cope with that?
Of course. A human body is a human body. There's pretty much only so many ways it can be fixed and so many ways it can break down.
That's not strictly true. Sometimes there isn't a right or a wrong answer. You'll find that out here.
Yes, but if one thing doesn't work, you try another. And if nothing works, they die. Absolute.
So what do you hope to get out of your time here?
After completing my training and doing a couple of hospital jobs, I like to be living in the countryside with my husband.
Oh, I'm sorry, I didn't realise you were married.
My future husband, whoever that may be. By then, I'll be specializing in dermatology.
Why dermatology?
It's where the money is. It's a particular interest of mine. I maintain a blog about skincare. What moisturizer do you use?
A very expensive one. Dr. Ashford, what moisturiser do you use?
You're looking a little dry. There's some excellent products out there based around animal placenta. I use them myself. I'll get you a sample.
How convenient, because Dr. Ashford here is going to be your mentor. I'm sure you'll learn a lot from him. Maybe she'll take a few years off you.
Excellent. Where can I get a uniform?
This way?
She's right. Marty's new doctor. Marty, or just didn't fancy you? She was rude to Robin too. Here we go. See, the trouble with doctors is they're a bit like women. You never know what's going on in their heads, and the younger they are, the more they expect you to get. She is a young woman. I rest my case.
What do you think you're doing? That's mine.
Jolly good, but you still can't park it here.
It's not blocking access. It's not in anybody's way.
Right, I tell you what, if you'd like to give me the keys, I will go and park it for you in a staff car park.
No way. You're too big. You break it.
Sorry, bro. Go back where you're done. Noel, mate, go and get a doctor quick.
That's a 12.5 millimeter solid steel cable. So good luck with cutting it, and I am a doctor.
So, that's the new Mardy one, is it?
Can you get a trolley, please? What's your name?
Oh, I wonder if you could help me. I have to find this warden. Next time, bring up glasses, you silly cow. Excuse me, I have to. It's very important to find...
This bed here, Doc.
Okay. Right, what have we got?
No idea. It's just dumped outside.
Can you tell us your name? No. All right, on 3. 1, 2, 3. Over on 3. 1, 2, 3.
Okay. Can you tell us what happened?
No way, mate.
Can we get him on Entonox and 10 milligrams of morphine, please? He was thrown from the van.
Can you tell us your name? Make things a lot easier for us if you could.
The more you tell us, the better we can help you.
No.
Can you put a line in, please? Okay. Oh, this is our new F2, Lily Chao. This is Charlie.
Good morning.
Use and ease, FBCs, LFTs, group and save.
Sats 97. Heart rate 110. Resps 21.
Looks like a closed fracture of the ulna. Let's get an X-ray to confirm. Should be able to reduce it here. Are you going to tell us who you are?
Look, you heard the doctor. What is your name? I mean, I can't just give you all these lovely free NHS drugs willy-nilly, not without knowing a medical history. What if you're allergic to, say, penicillin and your throat swells and your airways closes and you die on us?
It's not a diagnosis, Doctor. That's speculation.
I'm just taking all possibilities into account.
Dr. Chao,
Tony.
Good boy. Tony what?
Smith. Tony Smith.
Seriously? I am not trying to arrest you. I'm trying to help you.
Lily.
Well, if it's Tony Smith, I'm Lady Gaga.
Hi, love.
Hey, babe. I'm Jeff. This is Dixie. There's paramedics, mate. What's your name?
Susan.
Susan. Okay, silly question, I know. Where's the pain?
My chest. And my head too.
Just have a little listen to your chest then, okay?
And there were these three men. And they made me stop the car.
All right. Did that hurt, yeah?
No. The car way back crashed.
All right.
Okay, darling, just stay nice and still.
3006 to control, over.
Control, over.
Yeah, request the police, please, at this incident at Stafford Woods, over.
Oh, never mind that. Have you done a test?
Yeah, I can't be sure of the results, so I'm going to have to do another one a bit later.
Well, that's good news, isn't it? That's better than a clear negative.
Elliot, what happened?
Oh, I was mugged in the walkway through to the train station car park. You know, the subway. Somebody jumped me, but I'm fine. I'm fine.
You've spoken to the police?
No. It's nothing, honestly.
Oh, the CCTV is all over the station. They can probably see who followed you.
You know, he was wearing a hoodie. I didn't see his face. I'm fine.
Elliot, you're not fine. My God, you have a bad cut in the back of your head. Darling, I think you're going to need stitches.
No. It'll heal itself.
Elliot, seriously, you can't see this. I'm taking you to the hospital. I'm going to go and get my keys.
Lost a tooth.
I banged my face when I hit the floor.
There's some craps and consolidation. Have you got any chest pain?
A bit.
Sharp, dull?
Sharp when I breathe in.
Any particular side?
On the right.
Let's get a chest X-ray as well as a wrist and an ECG just to be on the safe side. Tony, you going to tell us what happened?
Near miss. I was crossing the road and some geezer clipped me. Sent me flying.
The van that dropped you off?
No.
Who were they then? There were two men?
I don't know. Just... They saw what happened, offered me a lift to hospital.
You'd never seen them before?
No.
We have CCTV all over the hospital. I am sure the police can identify the van. Because obviously you want to thank the Good Samaritans yourself.
Dr. Chao, can I have a word?
He's hiding something.
Our job is to treat him, not treat him like a criminal. That's someone else's job.
All the tattoos, the man-made fibers. Probably a drug deal gone wrong, got beaten up.
Find a porter, fast track his bloods to the lab, get him into cubicles, reception will help you. Now, please.
First impressions?
Well, she's medically competent.
But?
Just a bit scary.
Just a bit.
And when that terrible day of judgment arrives, the only one who can save you is the Lord Jesus Christ. Come and take him into your heart today.
Can anyone give me directions to Warren Lane, please? Can you, Sonny? Thanks. May the Lord go with you.
Someone needs to get some help. Someone call an ambulance.
I need a porter.
We met?
Dr. Lily Chao.
Chao.
You say I can't have a porter?
No, I'm saying if you need a porter, all you have to do is look for one as opposed to ordering me to do it for you.
Mac, Dr. Chao here needs a porter.
Oh, excellent. Instead of trying to remove a perfectly harmless park scooter, maybe you can do some real work. These bloods need to be turned around ASAP, and I need a patient transferred from recess to cubicles.
Interesting. Enter the Dragon Queen, eh? Don't worry, boys, I'll protect you.
Zoe, it's Susan Bridger, 32 years old, rolled her car at 30 miles an hour. No other vehicles involved. She wasn't KO'd. GCS has been 14, 15 on the way in.
Right.
She's got a facial laceration, minor erythema to her face, which is probably an airbag. She's got a chest injury, which I'd say is a seatbelt. BP's 125 systolic, pulse 80, and SATs at 97%. They're giving her 5 of morphine.
Thanks, Jeff. Hi, Susan. I'm Zoe, one of the doctors here. Lily, can you give me a hand, please?
Let's have her over when we're ready on 3, please. 1, 2, 3. That's it. She was trying to escape from 3 men. The police are on their way.
Did they hurt you?
No, I stayed in the car, but I think I ran one of them over and were trying to get away.
OK, don't worry. There'll be plenty of time to talk to the police later. Let's get ready to do a log roll, guys.
OK.
Yeah.
OK, when I say on 3, 1, 2, 3.
Thanks, Dixie. OK, Susan. That hurt there?
A bit, yeah.
And there?
Yeah.
OK, let's get her.
On 3 again. 1, 2, 3.
Start getting the monitoring on, please. Just going to check your neck here, Susan.
No, you got it.
Is that tender there?
Yeah.
OK, I'm going to need a head and neck scan, please. Control to 3006, could you do a quick turnaround? Junction of Clipper Street and Spear Avenue.
3006 to control. Message received, we're on our way over.
It's this way, Mr. Thomas. There's nothing to worry about.
Right, watch your backs, please. Watch your backs. Thank you.
I'll soon get you sorted. What's your name? Agatha.
Okay, I'm just going to check you over, Agatha, all right?
Looking very glamorous, Agatha, if you don't mind me saying.
I do mind you saying. Is your partner always this lippy?
Oh, she always is, I'm afraid. Day and night. Day and night.
Oh, my head.
Okay. Agatha, I'm going to give you something for the pain, love, okay?
Will this take long? I've got somewhere to be.
We need to take you in and get you checked over properly, all right?
Oh, nonsense. The bones got rattled a bit, but I'm fine.
No.
Stay where you are. We'll grab a board, all right?
All right, darling.
I'm not getting on one of those things.
Okay, all right, stretch it.
All right.
I'll be right back, sweetheart.
It's all right, darling.
So how did you do this? He was mugged. Sorry to hear that. Is anything else hurting apart from your head?
No, I just got a good old whack to the back of the head.
Okay, that'll need stitches, I'm afraid. Sorry. There seems to be something lodged in the wound. Did you hit the ground with your head?
I don't remember. He just sort of grabbed me.
Okay, I'm going to clean up the blood and get a doctor to come in and take a look and tell us what we're dealing with. Okay?
My self-proclaimed hit-and-run patient, cavitating lesions, gonate focus, right apex of lung, no obvious consolidation, hilar lymphadenopathy.
You're not thinking pulmonary TB.
Can't be 100%, but shows all the signs of living on the fringes of society. No BCG scar.
OK, I'll get the respiratory team down for a second opinion. You check his sputum cultures for MCNS and get some antibiotics into him. How many members of staff have been in contact with him?
Me, Lily, Charlie.
Okay, well, we can presume you 3 are immune. Make him top priority. You can't miss cross-contamination. I'll have to shut the entire ED down. Send me that X-ray and his history.
That's the tricky bit, getting his full medical history. Ah, Dr. Chao.
Yes.
Tony Smith. We need to move him to HDC. Think he's got TB. Need to isolate him.
TB? Who gets TB anymore?
Well, when we find out his real story, I'll let you know.
I thought you said our job isn't to play detective.
I was on my way to see a friend. I can't be very long. I'm feeling much better now.
Oh, that's just the pain relief talking. And you're not going anywhere till we checked you out thoroughly.
That's the problem with you young people. It's all mind the gap, health and safety. No backbone.
Well, you're not going to have any backbone left either if you don't let us look after you.
Put that on your finger, darling.
Look, we think you may have fractured your hip.
Boyfriend?
No. No, not a boyfriend. Right, Jeffrey. Nice and easy, please.
Right.
No bone shaking. Right. Hospital's not too far. We'll have you there in a couple of minutes.
You didn't tell me your name.
I'm Dixie.
Dixie? Dixie, what are you, an American showgirl? You don't look a bit like 60.
Huh? What do I look like then?
Doris. You look like a Doris.
Right, Jeffrey. When you're ready, please, love.
Righto. Doris.
How are you feeling? You okay?
Elliot, I'm fine. I'm not the one lying on a hospital bed. I'm okay. When you do fuss.
Look, maybe you should nip out and give my mum and dad a call. Let them know what's happened.
Yeah? Okay. Okay, you're right, yeah. I'll be right back.
Please try to keep this on, Mrs. Smith. We can't risk cross-infection.
Anyone we can call for you, Agatha? Going to meet you at the hospital?
No, I have no family. Never married. No brothers or sisters. And I know I don't look old enough, but both my parents are dead too.
Oh, come on! Get on with it, mate! Blue light's not just for show, you know!
Sorry, it's not always easy getting around in Holby traffic.
Try driving a makeshift ambulance in a war zone, dear, then you'll know what easy is.
Oh, you did that?
Spent most of my career working aid relief overseas. Africa especially. You know, all those lovely hot war zones in the 60s and 70s. Biafra, Uganda, Sierra Leone.
Oh! Sorry!
Okay, Agatha.
I feel a little dizzy.
Okay, Aggie, just stay with me, darling. Jeff, she's deteriorating.
I thought I'd lost you. You can't go wandering off, mate. Come on, let's take a look here, all right?
That bloke in there, do you know what's wrong with him?
No, he's not my patient. Now, if you've changed your mind about talking to the police, they're here taking a statement from another patient.
Yeah, if they're here already, that might be the best thing. You couldn't just point us in the direction of the bathroom, could you? I'll only be a minute.
Yeah, they're just through those doors to the left.
Right, thanks. Susan?
Elliot, what are you doing in here?
Oh, I was worried about you. Are you okay?
I think so. No one said anything about any major surgery. Is Georgia with you?
I need that bed changed over fast. We've got an RTC coming in.
And look, the police are here. I'm going to tell them what happened. I just saw the
No,
bloke.
Elliot. You can't, not with Georgia here.
But
She already has bad memories of this hospital.
I just think... So the IVF might have worked. Georgia might be pregnant.
That's great news.
I should get back. Okay. We'll talk later, all right?
Okay. Thanks.
I spoke to your mum and dad. I send their love. And I cancelled that reservation for tonight.
Oh, good.
Right, let's get you cleaned up, Mr. Thomas.
On here.
Yeah.
Good news, Susan. Your scans have come back clear, so we can take the collar off her now and sit her up. We're going to transfer to cubicles, Lily. Can you sort that out?
Of course. Should I notify that gentleman?
Oh, no, he's just my brother-in-law. He had an accident today, too.
Not a very lucky day for your family.
No.
Patrick, 72, came off worse, pedestrian versus bike. GCS was 15 at scene, dropped to 13 en route, 10 of morphine and some Entonox. OK, let's get her over, please. 1, 2, 3. OK, Aggie, don't worry, darling. And over, 1, 2, 3. There we go. A SAT's a 92, a BP's 110/60, a pulse is 100, clearly pelvic fracture. She's complaining of lower back pain and she's refused spinal care.
Did you hear me complaining?
Hello, Agatha. I'm Sam, one of the doctors here. Could we get a portable X-ray down here, please, for the neck, chest and pelvis?
Yep, I'm on it.
Actually, will you give Dr. Nichols a hand, please? Sam, new F2.
Sam Nichols. Hi. This is Robin.
Lily Chao.
We've met. Right, let's get bloods off. U's and E's, FBC and cross-match, 6 units. Robin, I want her on 1 gram IV paracetamol.
Oh. Agatha, this is an awful lot of money you're carrying around.
Well, when you get to my age, you don't care much about whether your bum looks big in this.
Do you know how much there is?
2,000, maybe.
Okay, well, we'll get it counted and put it in a safe for you.
I want her to look after it.
No, I can't, love. I've got to go back on duty.
I trust you.
Okay. I'll get it put somewhere safe. Are you on any medication, Agatha?
Yes, I take warfarin. I have a couple of DVTs. Oh, my yellow book is in my handbag. Will this take long? I'm rather hoping to get a date I have later on.
A date? I haven't had a date in weeks. Leave some for the rest of us, eh, Agatha?
I'm afraid you won't be going anywhere for a while, Mr. Kirkpatrick.
Robin, can I have a quick word? She's been on 2.5 for about 10 years. Could you ask the lab to do an INR and clotting screen? And we also need to get a warfarin reversal agent. Could you also ask Dr. Chao to cross-match 4 more units and write up the fluids?
Yep. Sam asked if you could add 4 more units to the cross-match and to write her up some fluids.
Of course. Can I suggest something? You need to be less informal with the patients because this isn't a place for gossiping. We need to prioritize their treatment and anything else is just a waste of NHS time and money.
Sorry, all the doctors are backed up, so I'm gonna have to check the wound for infection.
Did you manage to test again?
No, not yet.
Is everything all right?
Yeah, we might be pregnant.
Oh, congratulations.
Oh, we're not sure yet.
If you want, I can refer you to the obstetrician.
No, thank you. It's too early.
Okay, let's get your husband cleaned up. I'll be back in a sec.
Globalnet.za. Where's ZA? Is that New Zealand?
South Africa.
Right, so there's an old lady with a large sum of cash and a hotel booking. Goes to meet a bloke from South Africa she's met on the internet. That almost never ends well. Can you keep that somewhere safe for me? And can you do me a favour? Check out that email address. Cheers, Louise.
Well, the neck's fine, but there's a significant pelvic fracture. Let's get a CT and refer her to orthopods. What's wrong?
I think that Dr. Chao, she's really bossy and I don't think she likes me very much.
Really?
She says all I do is waste NHS time and money.
Well, I know that's not true. I think you're a brilliant nurse.
Really?
Yeah.
Thank you.
You're welcome.
I'll go and contact orthopods. Those bloods you wanted fast-tracked.
Oh, great. Could you open it so I can read it, please?
Sure.
Pretty much confirms it's TB. Thanks, Louise.
You know, that mask really shows up how lovely your eyes are.
Thank you.
You look good in a mask. Idiot.
Thanks, Lamorna. How are you feeling?
Bit better, yeah.
I prescribed antibiotics for the TB. It's treatable, but it's contagious, so you'll have to stay in isolation. I'm just arranging to have you admitted.
Can't stay here. I want to go home.
Not in your condition, I'm afraid. Now, Tony, where do you live? I need to know how you caught it. I need to know you haven't infected anyone else. If you're trying to protect someone, you're going about it the wrong way.
Mostly I sleep rough. That's how I caught it.
So you were mugged?
Yes.
Would you mind giving us a moment alone?
If it's possible, I'd quite like to stay, actually.
Coffee shop is in the reception.
Okay. Well, I'll get us some teas.
Now, where were you attacked?
At the train station.
The train station.
Yeah, I just got home.
Stay still.
I've been away at a conference in London.
There's definitely something in there. I think I can get it. I understand your sister-in-law is also the victim of an attack this morning, miles away from yours. Says she ran one of her attackers over.
Ah, well, good for her.
Nurse,
Obviously.
can you get a suture kit ready for Mr. Thomas? And can you also find out exactly who made the 999 call this morning about Susan Bridger? Show me your teeth. Do it. Tooth, the whole tooth, and nothing but the tooth. I have got 2 more patients out there, a man and a woman. She says she was attacked by 3 men. Let's say that was you and 2 men who dropped you off at hospital.
Don't know what you're talking
How's
about.
their health? Are they coughing? You do realize that TB is the 2nd most common form of death from infectious disease after HIV.
Death?
If they've been around you, they need testing as well as treating. Fine. I'm going to file a report right now.
My brothers. They're my brothers.
Where did you go?
He lives with his 2 brothers in a caravan in a field down a single track lane at Folleybrook Farm. We need to send the police to locate the brothers because they are most certainly infected. Any luck on that 999 call?
He didn't leave his name.
And you're sure that was a he?
That's what I was told.
I wish people wouldn't lie to their doctors. My job is difficult enough, you know.
What do you mean?
If people tell me they drink 20 units of alcohol a week, I know they mean 40. And if they tell me they smoke 10 cigarettes a day, I know they mean a pack.
Chao.
We might have to send him into isolation until he tells us the truth.
Isolation?
You didn't get that at the railway station this morning, did you? You were with your sister-in-law when she was attacked.
No, that's not what happened.
Mr. Thomas, my concern here is that the men who attacked you both this morning were infected with pulmonary tuberculosis. And since his tooth was embedded in your head, you may be infected. If you want to be so melodramatic as to be having an affair with your wife's sister, that's your business. I need to know the truth so I can treat you
Hang
both.
on, it's not... Yes, all right, we were together, okay? But I don't want my wife to know yet.
We're about to send you into isolation, so is there anything we don't know?
Mrs. Thomas? Mrs. Thomas, are you okay? Where are you going?
I don't know. Home.
Well, does Elliot know?
I don't think it matters anymore.
Look, why don't you come and sit down for a minute, okay?
Honestly, I'm fine. I just feel a bit dizzy.
Oh, can we get some help over here, please? Can you grab a wheelchair?
What's happened?
I don't know, she said she was feeling dizzy. She told me earlier that she might be pregnant.
Now get up and then can get onto the bed. Take your time. That's good. Okay, put your head back. That's lovely.
Georgia, what's going on? Is she all right?
No.
It's okay. Has she collapsed like this before?
No, I don't think so.
She on any medication?
Yeah, antidepressants.
What sort?
I don't know. Georgia, we lost a baby a few months ago. A stillbirth at 20 weeks.
Okay. How are you feeling, Georgia? Any pain anywhere?
No.
Oh, Charlie, could you arrange a repeat HCG? Check for possible pregnancy. Thanks. And I'm sorry, but Elliot has had contact with a tuberculosis carrier. And while his chances of being infected are slim, he in turn has had contact with you and your sister. And we can't risk cross-infection in the hospital, so I'm going to have to isolate you all.
I heard what she said about the affair.
No, Georgia, it's not what you think.
Can you arrange for Elliot and Susan to be moved to HDC as soon as possible, please? Georgia will follow in a few minutes when she's recovered.
Hang on, let me explain. Please, Georgia, you've got it wrong. I can explain.
And please, I need you to stay in your cubicle until we move you.
Listen to the doctor. Let her rest.
That email address, it belongs to an expat living in South Africa.
Right. Well, maybe I'd got Agatha wrong. It must be someone she knows from the old days.
Oh, poor old Freddie's probably travelled thousands of miles just to get stood up.
Yeah. Yeah, thanks, Louise. Jeffrey, it's me, darling. Right, I'm going on a break. I'm going to be about 15 minutes.
All you need to do is relax for us, Agatha. We'll do all the work.
I don't care for enclosed spaces. I've spent most of my life living in big open ones.
Will only be a few minutes. I'll leave you in Jamie's capable hands.
Try and stay nice and calm for me, Agatha. Big, deep breath.
I don't want to be in here. I don't want to be in here. I don't want to be in here.
Stop. Can I get some help in here, please? Okay, Jamie, go upstairs and get some blood. We'll give her a couple of units stat. It's okay, Agatha. Try and stay calm for me.
Where's the porter, the old man with the funny accent?
He is replacing a fuse.
I have 2 patients in cubicles. Need transferring to HDC?
Fine.
It's that way.
Excuse me, young lady. I was finding my own way to cubicles before your mother was in need of a midwife.
You need to keep them better organized. I've been here half a day and I can see that this area is central. Everyone passes through here. If they check in with you every time they finish their task, you know exactly where they are at all times.
Yeah, that's brilliant. I'm going to issue a memo right away.
Ah, Dr. Chao. Would you like to follow me, please? Listen to me and listen to me very carefully. There's a great deal more to being a doctor than just assessing and treating people's symptoms. There's an old-fashioned phrase, bedside manner. All the best doctors have a good bedside manner. Right now, you don't.
Hang on. I thought I was doing a good job.
This ED is a team. We protect each other, work with each other, rub along as best we can with each other. The nursing staff are your friends, and trust me, you really want them on your side. Also, you had no business talking to Elliot Thomas in the way that you did.
But if I hadn't pushed him, we may well have let him walk out of here infected with TB.
You made a judgment and offered an opinion on his personal life. That's nothing to do with the clinical decision-making. Also, you did it in front of his wife. Let's just try and get through the rest of the day without repeating any of those mistakes.
Thank you, Mum. I've got to go. Right. Sorry, I had to tell someone.
Okay, don't worry.
The other doctor. He said that Susan was here.
Yes, she was with your husband when they were attacked, but she's okay. No serious injuries.
He told me he was at a conference and he was with Susan. He lied to me. I really can't be here.
Sorry, that's not possible.
Can't be in isolation with Elliot and Susan, not after what happened. At least isolate me somewhere away from them.
You're gonna have to talk to them sometime. In my world, sooner is always better than later.
Are those my pregnancy test results?
Yes.
Georgia? Georgia, you okay? We've been worried sick.
I'm fine.
Right. I'm afraid Georgia's repeat pregnancy test was negative.
I'm so sorry.
But under the circumstances, it's probably for the best.
Georgia.
Don't, Susie. I know, okay?
No, you don't. I was with Elliot this morning, but not in the way that that doctor thought. He'd taken me to a private clinic out of town. I've been having some tests.
Tests? Tests for what?
I got the results this morning. Georgia, I've got cancer. Sorry. And I probably should have told you sooner.
No, that's all right. Do you need a referral to a specialist?
No, Elliot's sorted all of that out for me. He's been a rock, Georgia.
Excuse us for a moment.
Why weren't you going to tell me?
We were. Just didn't want to tell you while you were having IVF. I didn't think it would be fair.
Fair? You're my sister. Of course I want to know. I can handle it. I may not be happy about it, but I can handle it.
Sorry.
You don't have to pretend that you don't have cancer for my sake.
You can't go giving me all your money, then popping your clogs. Imagine the paperwork I'd have to fill out. How are you feeling?
Old.
You're not that old. From what I hear, you had a dirty weekend planned. Who's Fred, then?
A chum from the old days in Africa. His wife is still alive the last time I saw him. But we found each other online a few months ago. What's the time?
12:25.
Oh, poor Fred, he's only here for a few days. I was supposed to meet him at 1. I wanted to get there early, to get a seat with a flattering light. I was going to use that money to run off with Fred to Africa. There was still 200 in my handbag.
Yeah, well, I was afraid to go in your bag knowing you were going on a date.
Quite right.
They're going to take you up to theatre now, Aggie.
Have you returned that text yet? That one from someone who's not a boyfriend? As if I didn't know what that meant. It's all right for you to laugh. You still got a date tonight, if you want it. But what's poor Fred going to think about my not turning up?
Actually, he'd quite like to tell you himself.
Fred!
Hello, my dear. I'll be waiting for you.
I hadn't planned for him to see me in bed until after the 3rd day.
Good luck, Aggie.
Thanks, Doris. You're a star.
You go well.
Thought you were getting the tea.
Yeah, well, I couldn't leave poor Fred waiting in the cafe, could I?
No.
He'd come thousands of miles.
Yeah.
Poor old Fred.
I wonder what would have happened if they got together years ago.
Oh, I don't know. Getting on with it now, though, aren't they? No time like the present, all that.
You never know till you try, eh?
Exactly.
Cheers, kid.
I made a tea.
Carol. Hi, love. It's Dixie. Sorry, it's been a bit of a mad day. She accused a man of having an affair in front of his wife.
Then planned to write her own glowing report of her day's work and have me sign off on it.
She's the first doctor I've ever met who's keen on doing her own paperwork. Tess is going to love her.
Yeah, good luck with this one. Just try and get her to stop being so rude to everyone. Then we can wave her off to a Harley Street skincare clinic.
I don't know.
What, seriously? You like her?
Like, it's a very strong word, very strong. But I think she's got something. If she had a little personal charm, she could be a brilliant ED doctor.
OK, Michelin-starred dinner says that you'll ask me to get rid of her before her time's up. Charlie, you're my witness.
Actually, I'll have a slice of that action. You know she's right.
Okay, Michelin-star dinner says I'll have her committed to being an ED doctor by the end of her attachment.
How long is she going to be here for? F2 is usually 6 months, isn't it? She can't go treating people like that for 6 months.
Oh, I don't think she's that bad. You two, you're just frightened of strong women. Look how you treated me at first.
Oh, no, I'm not liking this. Louise and Lily becoming pals. That's like crossing the proton streams in Ghostbusters.
Quick, stop! Hey, come on!
You were right about those bolt cutters, Zola.
Oh, that's not a very good end to the day.
The way my day's gone is the perfect end.
Up?
I don't think I'm going to fit in there tonight.
I know,